Measurements in imaging have always been an important part of imaging. For example, in an echocardiogram, it is literally impossible to determine the function of the heart by just looking at the ultrasound study of the heart. So the heart in motion. What happens is the heart in motion is freeze-framed with the heart in full contraction and full relaxation, and then the heart chambers are accurately measured, and that's what dictates the function of the heart. Measurements in mammography are important. If a woman has a nodule in her breast, measurements are used to determine if the nodule is growing, and that's done in reevaluations. Now, the technology in all of imaging to measure things is a standard technology. It's a standard technology built within a DICOM format. DICOM is the international format of how images are to be produced in softwares, managed, handled, and also measured. So in a DICOM format, you basically have the actual size of the images by pixels in the image. So it's very easy to accurately measure things. Sometimes in the spinal injury space, providers will ask the question, or attorneys will ask the question, is an excessive motion test, will it pass a Dauber-Frye challenge? Yeah, of course it will. It has every time, because it's just using standard imaging technology. There's nothing new or experimental or investigation about the technology that's being used. And by the way, the technologies are FDA cleared. So in the case of spinal kinetics, our technology is FDA cleared. So there's nothing different or weird or unusual about the technology itself. Now, how we programmed it and what we do with it, yes, that is specific to what our needs are. But there's nothing unusual about it. So measurements in the spinal injury space are incredibly important, because without measurements, you cannot determine the severity and location of a spinal ligament injury, the spinal support ligament injury. So in the spine, you have two tissues. You have bone and connective tissue. So if you fracture something, that fracture, or that separation of bone, is the imaging biomarker that you're looking for that dictates that you have a fracture. If you herniate a disc, which is one of the ligaments of the spine, the nucleus is not a ligament, but the tissue around that holds the nucleus in is a ligamentous structure. When that herniates, the imaging biomarker is the herniated disc on the MRI. When the non-disc spinal support ligaments are injured, the imaging biomarker is excessive motion, and that has to be that has to be measured accurately on the functional X-ray study itself. So the more excessive translation or the more excessive angulation that one has in the spine, the more damage there is to the spinal support ligaments. Without an excessive motion test, it is literally impossible to determine the severity and the location of a non-disc spinal ligament support injury. As a matter of fact, patients can have a surgical level of this spinal soft tissue injury that they can have it with or without disc herniation. In other words, the person could have a surgically qualified level of spinal excessive motion where there is no disc herniation. There's only damage to the spinal support ligaments. And so it's very important. Without an excessive motion test, it is literally impossible to determine how badly damaged these spinal support ligaments are. So if anybody, whenever we hear at Spinal Kinetics, when we hear, well, gosh, my attorney doesn't understand this, or my insurance adjuster doesn't understand this, you have to remember that no one in the country, no chiropractic college has a formalized education on spinal injuries. No medical school has it, no osteopathy school has it, no doctor of PT school has it. These are the first, fourth, and sixth leading cause of chronic pain and disability, and no doctor in the country has had any formalized education on them. So that's why there's so much confusion in the market about it. It's also why there's super high levels of chronicity. In other words, patients don't get great results with treatment from the providers that they're working with oftentimes. Statistically, you may be a provider that gets very good treatment and very good results with these types of injuries, in which case you should be the busiest provider in your space, bar none. And you should be one of the highest paid. But the majority of patients that are in the market, statistically, are going to have a very difficult time with these types of injuries. So at Spinal Kinetics, our accurate assessment motion study is so that you can have an accurate assessment of how badly damaged the patient is right away, so that the treatment innovators can get to work treatment innovating to get much better results with these types of conditions. Now, we happen to have there's an idea in the market that doctors can see these studies, see these injuries on their x-rays. I'm going to challenge you to prove that you can do that. Like, prove that you can actually, if you're a doctor out there right now that says, hey, I can see these, I don't need to send out for an excessive motion study, prove it. All you have to do is hit the link below. We have a You Can't Eyeball It campaign. You pick the x-ray, you pick the level, you pick whether it's an angular finding or a translation finding, and if you pick it, you'll be in for $500 coming to you out of my pocket, cash out of my pocket, which anyone that picks the level will put you in a hat and pick the winner at the end of the month. So just click the link below. It's a fun campaign. Take a shot at it and see if you can't pick out which level has the most excessive motion.